What I enjoy most about taking care of patients as a general surgeon is that I really get to be involved in different aspects of people's lives. It's kind of like the family medicine of surgery. I get to work with young kids. I get to work with adolescents as they're growing up, moms, grandparents. Some of the best accomplishments that I've had in the North Country so far are being able to take care of 3 generations of a family, and that's really special. My road to medicine was a little bit different. I had multiple careers before going back to medical school, both farming and construction. Being able to give back with this skill set of a general surgeon to a community like this is really important. I grew up in a healthcare family. My mom and sister are both nurses, and so I always had that in the background. But being a general surgeon really helped me combine both my upbringing of taking care of people, as well as a little bit of construction. Working in the field of general surgery is different wherever you live. I think in the North Country, this is a really unique place where a specialty like mine is really required to provide a very broad spectrum of skills. Over the past few years, and what we're going to continue to do here is build a robotics program, and that brings state-of-the-art technology to a rural community. And no longer do you have to travel to the big cities to get that kind of care, and so that's really important. So I'm happy to be working with St. Lawrence Health for multiple reasons. I think that in the North Country, access to care has been really difficult for many years. We're a very isolated community, both geographically and by weather, and we know that nobody likes to travel to get health care. It's really difficult. And what St. Lawrence Health has done over the last few years is really start to make that possible to get a high level of care at home. With the hospital system and the recent affiliations, growing local nurses, growing paramedics, improving medical transportation. It's really exciting to see what's going on in the North Country, making a health system like this a reality for people in the North Country so that they can get really high quality care close to home. I do a little bit of everything, and I think that's what's really nice. When you come to my office, you're not just there for a hernia consultation. We're going to talk about your colonoscopy. We're going to talk about your wife's mammogram. We're going to talk about your kids. I really try to provide a holistic family medicine approach to surgery.